Fala galera, mais um vídeo aqui pra vocês de Sujeira Squad. Então vamos que vamos aqui. O doutor aqui falando, né? Vamos deixar ele aqui falar.
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
Nossa, olha como a minha ficou.
Great job. We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place. Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth. Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them. Wow, what a marvelous job! I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces. They circle the whole tooth and have a hook on the outside of the tooth. Slip the molar band over the tooth. We'll cement it into place later. Great. Now we can start putting the bonded brackets on the rest of the teeth. We've placed a lip guard over the teeth to give us room to work. Let's rinse off the teeth. Can you spray them with water? I'll run the suction to remove the water. Let's spray some air to get the teeth nice and dry. Can you handle that for me? With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Pronto. Botamos, eu acho que é a cola, a cola. Agora vamos botar os brackets.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Pronto.
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
Eu não sei botar parede, então eu não sei fazer isso, né? Galera. Isso aí. Galerinha, agora a gente vai botar os
Great job. Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place. Good job. We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
Deixa ele falar, hein? Não tô entendendo nada.
And with the last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist. It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and the colon is responsible for the final stages of the digestion. It absorbs remaining water and electrolytes from indigestible food, accepts and stores food remains that weren't digested in the small intestine, and eliminates solid waste from the body. A colonoscopy allows your doctor to view inside your entire colon using a device called an endoscope. As the scope moves into your colon, your doctor views the output on a monitor to check for growths or polyps. There are several parts to the colon: the cecum ascending, the transverse, the descending, and the sigmoid. A colonoscopy can check each one of these areas. The one thing about having a colonoscopy is that a doctor can find polyps and remove them immediately. This is the most effective way to prevent the development of colorectal cancer. However, you'll need to cleanse your colon 24 hours before the test by taking laxatives or performing a fleet enema. Also, use of the endoscope might accidentally tear the colon walls and cause bleeding. Plus, you'll need to be sedated during the exam, which should take about 30 minutes or longer if any polyps are found. We have a 53-year-old female waiting for her colonoscopy. Let's get scrubbed and take care of this. Our patient is lying on her left side, knees drawn up to her stomach. She's wearing a gown, and we have a sheet draped over her. Let's set her up with an IV drip of the sedative.
Limpar aqui. Ai, minha mão. Ui. Nossa, velho. Ui.
Great. Now we'll wait a few minutes for the sedative to take effect. Our patient is sedated and ready. She stated that she's cleansed her colon, and I've already used a lubricated, gloved finger to check for blockage. Be sure to tell the patient that she should breathe slowly through her mouth to relax her stomach muscles if she feels cramping. We'll insert the endoscope into the anus and slowly move it into the colon. The endoscope contains a small camera and light, and a pair of forceps so we can remove any polyps we find. First, let's lubricate the scope for easy insertion and passage through the colon. Carefully insert the scope into the patient's anus and slowly move it into the colon. We can watch the camera's output on the monitor. We're into the rectum now. Nothing so far. Let's move on into the sigmoid colon. Slow and steady. You're doing a great job. Descending colon's next. Now's a good time to remind our patient to breathe slowly through her mouth as we do the exam. All right, let's move into the transverse colon.
Nossa, não vou aguentar jogar não. Galera, se inscreve aí no meu canal. Me siga aí nas redes sociais.
Uh-oh, looks like we've got a small polyp in the transverse colon. We'll use the forceps to remove it.
É muito nojento. Valeu.